Hey, this is Lee again. Just wanted to give you a second half. Yesterday I showed you how to use a G-tube. I'm going to get it taken out tomorrow, so I was trying to get it done as fast as I could. I'm just procrastinating and not really feeling like doing it. But anyway, it's done now, so I want to show you all the little bits and pieces. I have some things written down, so I want you to get your camera ready or whatever and just take some quick pictures of it, and that way you'll have a list. It's a lot. I talk a lot. I write a lot too. Anyway, so I just want you to see what it is. Have a list that you can go over, and you can take it to your doctor with you. So just take a screenshot of it and go from there. Okay, so what I'm going to do now is turn it around if I can. Okay, now I'm having to. Okay, so this is the list that I made up. So you can take it to your doctor and talk to him about the G-tube, and this is the first page of it. Okay, so go ahead and take a screenshot of it, and we'll go from there. So some of the nutrition I want to talk to you about is adding other things, supplements that you can take to help your bowels and help you not be constipated, okay? Because it's a terrible thing. I didn't go to the bathroom for 5 days, and it got so bad I doubled over, and I needed to go to the ER and have them take care of me. And it wasn't fun, it wasn't pretty, it was a terrible experience. Anyway, I got done, and they took good care of me, and that's what they've been doing. Okay, so I'm going to show you this is what I look like before kind of photos. And I know you know what I look like now, so this is me with my daughter-in-law. I was taking her out to go surfing. Anyway, I had a regular life before all this happened, but this is what's going on now. So part of the G-tube is, I explained to you, it gets inserted in your stomach. This is how you eat. And I just happen to have to do it early because my right side of my body, my face was killing me. I had my teeth pulled on the other side, my chompers. I couldn't chew anything on that side. So I had to try to chew everything on my right side, and I couldn't. So I had to go to these supplements. These are the ones before I went to the doctor and found out what they had and what they could give me. But any one of these things, the little baby carrots and stuff like that, you can get this kind of stuff, but you have to use the grinder I was showing you before to add some water to it to get it through the tube. Sorry. This is the little hand grinder I got. It's compact, it works real easy. You just put the stuff in there, fill it up with water, get it so it's really liquidy because it doesn't matter. You got to drink the water anyway, and it gets through the tube easier. You don't want any clogs. We tried making a soup out of a stew, and I sifted it through, and there were so many chunks in it, there was no way. If I would have used it, I would have been clogged up. But anyway, baby food is really good for you. You've got all these nutritional things, plus it'll help you poop. So you got to make sure that you keep constant, okay? Because the supplement that they give you is, you kind of, when you go to the bathroom, it's kind of like, you know what sculptor's clay looks like? That's what it's like. It's hard as a rock. You can't get it out. You really just, you got to hydrate, hydrate, hydrate. So drink your 6 bottles of water, your Aquafina. Here's your other supplements that they give you. This one's for pediatric, this is for kids. But again, it doesn't have very many calories to it. And actually, this one has 375. That's pretty good. Anyway, and then this one here is a plant-based one. My daughter checked it out, and she said this stuff is really good. So I bought a lot of it. And again, the vanilla, because after a while, the burping just kind of like gets to you. Okay, and this isn't very many calories either. But this is the Ensure. Like I said, they have 2 sizes. This is a smaller bottle. 350 calories. You want to take at least 4 of these a day. So when you put them into the beaker that I have over here, you want to, that's nice and neat, keep everything together. Do 2 of those. Bring it up, or even 1.5. Bring it up to maybe 450, 500 cc's, because that'll fill you up, okay? And then fill it up to, with another 100 or 150 cc's up to 650 if you can handle it. See, what happened to me is my stomach shrank because I didn't eat. So you need to do that. And do 2 of these things, and that's 700 calories. So that's half your thing right there. If you can do 5 of those a day, you're going to be in great shape. You're not going to lose any weight. And again, just bottles of water. You got to have your 6 bottles of water here. Okay. Let's see. So that's really about all I've got for the feeding part. But you can use these other kind of supplements, no problem. You just got to make sure that they're, you can sift them, whatever you got to do. But these will also help your digestive system, help you get things out regularly. Because when it got to the point where I could only swallow about a teaspoon of water at a time because I couldn't swallow, I was always the coffee kind of guy. Coffee got me going in the morning, if you know what I mean. Anyway, I'm going to go on to the next step with another video here, okay? Thank you. Okay, so this is Willie again, the third segment here. I'm going to show you up close about the beakers and how to clean them and all that kind of stuff again, because I kind of went over it, but I want to do it again, okay? Okay, so like I said with the beakers, you've got all these, it's the cc's over here, it's ounces on this side. So just dump a couple of the bottles of the food, 2 of these guys in there, or 1.5 is even okay. Depends on how much you can put it in your stomach, okay? So the more the merrier, especially when you first start out, okay? You want to do that, and then when you put the water in it, bring it up about another 100 or 150 cc's. And once you get it all in there, use your little mixer here, like this, and put it down in there. Like I said before, you want to pour everything in on the side of the beaker so it gets less bubbles in it, less time to get gas in your stomach and make you burp. Just do it in here until you feel it's mixed. Take it out. I just run it immediately underneath the sink, and then I come back and clean it after I'm done. Okay, and like I was telling you before, there's 2 different types of syringes here. This one here has got the tip that it's just a regular tip, okay? And they usually use this for sucking blood out and stuff like that. Anyway, if you have this kind of tip, you have to watch out because it will slip off if you don't hold it correctly. Okay, so you don't want it to slip off when you have it set up inside your tube like this. Okay, because it will just, and then this thing will just run out. Sorry, I'm not doing real good with holding these things out today. Okay, so this is one, but the G tube that I had put in has got a twist cap on it, and this is the syringe I needed for me. I used that little piece as a for mine because it had the twist bottom on it to go onto my G tube. And anyway, so that helped me out. And the nice thing about this is you can move around. You don't have to worry about things because it's not going to come off. You just twist it on there. You don't have to get down too tight, just snug, and everything will flow through it. Remember, just fill up the tubes with the water and your drink, and just let it run down. Before it gets to the bottom, when it gets down to about the 10, fill it up again until the whole thing is gone. Once everything's gone and it gets down to about the 10 again, put water in it, to 40 or 50 cc's, and let it go down. I do it twice, and on the last one it gets down to here, then I put my plunger back in it, and I push it through the rest of the way until I know it's clean and cleared out, and then I hit my little lock on my G-tube, and it locks it, okay? And, here's the paperwork for this. So make sure you take a screenshot of this if you can. And on here it also says a little about a little hair clip. And the reason why the hair clip is on there is, it's this guy right here. Little baby guy. Okay, so when you're in the bathroom, if you sit down on the toilet, your G-tube could fall down into the water. Okay, so you don't want that to happen. So I take the little clip and clip it to the area that's holding against my stomach. Okay, so I'll show you that next, and then we'll move on to the next one. Okay, this is Willie. I'm back. I want to talk to you about the little hair clip, and to make sure that you don't drop this thing in the toilet. Okay, because the tube is 13 inches long, and if you let go of it, your food's going to taste like crap. Anyway, here we go. This is what it looks like. I have it attached to my tube. You see it? Attached to my tube, and then attached to this part, because it's got little horns on the back of it. I don't know if you can see them or not. And it won't fall off if you have them on there. And we can keep it there during the shower, while you're in the bathroom doing your thing, cleaning up and stuff like that. And if you want to, you can wear it outside, or you can just tuck it down inside your pants or whatever you want to do. It's not the best thing in the world, but you know what? I'm alive because of it. Okay? Next. Okay, one more time. This is Lee. Another segment. I'm going to show you that about the concealed carry case. They do make a case for G-tubes. It's just kind of weird. It looks like a little patch. It's got a hole in the center of it, and you're supposed to pull your tube through it. And that's all I saw of it. But before that happened, I had already bought 2 of these, and they're easy to get. They have little straps if you want to put them on your suspenders or whatever you want. But it's just a Velcro back, and you just wrap it around your stomach, and it's got a pocket here. It's got a little pocket with some Velcro to keep it closed, and it goes all the way through where your barrel would come through. Okay, so what I do is I tuck it halfway down so the clip is in it, bring it down, bring it back up, and then I have my entry to the feeding tube on the other side. And I'm going to put it on right now just to show you how easy it is, how quick it is. And this is so when you go out in public, you know it's not bumping into things, you know it's not hanging out of your shirt, because the rest of the time it looks like, if I can show you what I've got on right now. So, there. See the bump? I've got a bump. And I got this bump over here. My 3-year-old grandson goes, "It doesn't hurt, it's just a bump." So he always does this, and he touches it every night before he gives me a kiss and goes to bed. Okay, anyway, here's a concealed carry. I'm going to put it on right now. Just show you, it just takes a minute. There's my clip. Okay, so just put it up underneath it, and I tuck mine to the side a little bit. Okay, and then just reach around, boom, it's on. So then you have this strap. I tuck the strap in. Okay, take the clip off. Again, make sure this thing's all the way down, so squeeze it so it's got little ridges on the back of it. I don't know if you can see them. So little ridges in the back of it. And every time you move it this way, it'll unclick, and then all of your stuff will come out on this end, which you don't want. You want everything back here. And you can see that I still have some, if the food is going to come out of your stomach no matter what you do. Okay, but it doesn't smell, it doesn't do anything like that. If you do this correctly and keep it cleaned, you're going to be bacteria free, and there is no odors. Okay, just wash inside here. Bring Q-tips into the shower with you. Get them all rubbed down nice and good. Get some soap around there, and just sometimes you got to roll them because it does get sticky, and you do get some fluid that comes out of your stomach, no matter what you do. So you know you just have to take care of it. Just got to clean it. So watch yourself every day, and you'll be good. Okay, so this is what I do. I just kind of bend the tube. I try not to put a pinch in it, but sometimes it does. Open up the pocket. Stuff it down in there. reach underneath at the bottom, pull, and it's hidden. Also, I turn this sideways. Your clip will kind of roll on you sometimes. So when I know I'm going to be wearing this, I just turn it sideways, and I'm done. So as you can see, it's there, but it's not as obvious as it was before. It's very comfortable. It's a nice thick belt. The one that I saw with the one from the G-Tube place, it was really thin. It just looked like a band, like it would end up rolling up and like having a piece of rope around you or something. Okay, so there's that. Hey, this is Lee again. Next segment, we're going to talk about some pain management and how to keep you comfortable, okay? Okay, so this is my paperwork from this one. It's making sure that you talk to the right people. Tell your doctor more than you think he needs to know in order to get the right help. They have wonderful people there that will help you with getting your insurance to go through correctly, getting you some things to subsidize you, food cards if you need it, gas cards if you need it, and they'll also take care of any kind of a flight or whatever you need to if you need to go somewhere else. Like I have to go to Oahu on the 30th to get another scan done to find out if there's any more cancer in my body, and that checks everything out. So at that point, I'll know whether or not I still have cancer and I have to continue on with treatment. But anyway, I hope, fingers crossed, I'm okay. All right, so here's what we're going to talk about. Sore throat was the biggest thing that I had, okay? So I was trying to take the little pill, or the little candy things that you suck on for sore throats and things like that, and can't remember the names of them, but you guys know. Anyway, so it only helped for a while. After a while, I couldn't suck on anything, and I had so much phlegm in my throat, I couldn't swallow it. My tongue wouldn't work. I didn't have enough muscles in my neck to spit it out. It's pretty gross. So anyway, whenever it would hurt really bad, I would just spray it with a sore throat spray, and it seemed to help a little bit, not a lot, but it stung. I had lesions in there getting burnt, and things like that from the radiation. Okay, Biotene. My dentist told me about this, and it's for dry mouth, but it seemed to help when I was using it for getting rid of some of the thick phlegm. I call it a cow cud. That's the easiest way to say it. That stuff that hangs out of the cow's mouth, that's what you have in your mouth. That's what it's producing to help you with the radiation. The radiation part is it's kind of brutal. Anyway, this will help you with a sore throat. This will help you with your thickness of your cow cut. The other thing is, I took little small rolls of toilet paper with me, when they get about that big, and I keep them with me all the time, because I found the only thing and the only way I could get that cow cut out of my mouth is to take and fold up a couple of pieces of toilet paper and literally wipe it out and then just throw it away. It was gross. Your spitting reflexes is gone. Anyway, they do have some things for you. Mucinex, okay? I bought this first and then found out that I couldn't use it because first I couldn't swallow it. I didn't realize that these pills are huge. They're huge. And the other thing is they're time released. So anything that's time released, read the label. You can't grind it up. But if you're taking medications and you can't get them down your throat anymore, you need to get a grinder. Okay? You can get them at the pharmacy or you can get them at the hospital, and they're usually free. And you just put your pills in here. You guys have probably seen some of these before. Guess I should open it first. Hang on. I'm back. Anyway, so 2, 3. See if it'll refocus. Okay, anyway, what it does, it grinds pills up in there for you, so you can take those and put them inside your syringe and actually just pump them into your stomach with your liquid food. Okay, so there's also Miralax. Take that. If you're taking any kind of opioids will cause you to get clogged up real quick. I was taking some light opioids and it wasn't bothering me that much. And then when I switched over to a heavier one, and I was taking 4 times instead of 1 time a day, that's when I got really backed up. Okay, so anyway, Miralax, take that every day. Okay, the other thing is, here's the Mucinex. I didn't realize it, but my friend Ronnie, who had throat cancer too, told me to get Mucinex. This will help you get rid of the thickness in your tongue. There's one for the daytime and one for the nighttime. I'm going to turn this off and start out because everything's out of focus and I have no idea why. Okay, there we go. Okay, so this is for the daytime. This is for nighttime. It'll help you sleep, and it will get rid of some of your thickness of your cow cut. Okay, so those are a couple of things. I didn't think I'd ever have to use these. I had to get some suppositories because that's how clogged up I got. I even got myself a home-based enema. I did that, but it didn't help. So I was all clogged up for almost 6 days, and before I went to the ER, and they had to take care of me and get it all taken care of, which is not fun. Anyway, so this all happens with a combination of all the stuff that's going on with your body, but mainly it's the medication you're taking. So when you talk to your doctor, say, hey, does this medication help get me constipated? And that's where the baby food comes in too. You can buy some stuff that'll actually, work with you and work with your body. Okay, so next segment, we're going to go into the chemo part, okay? Hey, this is Willie again. Just wanted to show you guys the next segment where we're talking about the chemotherapy part, okay? Okay, so chemotherapy, that's where they place a small port up in the top of your chest. I showed you about that, my little bump. And they plug you into I hope you're getting all this. They plug you into a machine that has everything custom mixed for you before you get in that day, and then they put it in through the port into your body, and it circulates everything. They put a few other things in there. I don't know exactly what they are, but mine also put a little stereo in there, and that's why I always felt so good when I left. I was just like, yeah, I talked too much, my wife went nuts. Anyway, so this is what it looks like in the chemotherapy room. Okay, there's a whole bunch of stations, and it just you can pick usually wherever you want. Sometimes it depends on what they do. Sometimes they have a seating arrangement, sometimes they don't. But it's very comfortable, and you can see the TV monitor back behind me. You can swing that around in front of you and watch it. But I like listening to my own music, and I like watching videos. And I bought this little doodad that's made for a cell phone. So I attached it to the table over here on the side, and I could watch videos, I could listen to my music, and I could work. I'd also bring my laptop, so I'd put I bring a backpack with me, a couple of bottles of water, and anyway, it was comfortable. So this is the little gadget that I bought. It's very sturdy. This will actually hold a tablet. So you just clamp it down to the side of the table, and you can rotate it and adjust it any way you want. And it's a wonderful thing. I actually have a link somewhere on one of these pages that you can see, and you can actually go and check it out and get one for yourself. Okay, so anyway, the chemotherapy takes about 2.5 hours to go through. And like I said, it didn't bother me at all, not even a little bit. You know, I get out of there and I was feeling good, and you know, so I think the biggest thing was again, was hydration. You got to keep, and I didn't like feed myself there because I didn't know how much I needed and all that kind of stuff. So I never brought the food with me. They have food there and stuff too, but always just bring what you like, and you're a lot better off. Okay, but I was drinking water the whole entire time. You can see my bottle of water over there on the table. Okay, so now we're going to go to the radiation part. Okay, and we'll be right back. This next little segment we have, loose skin, is for radiation. Okay, well, what I had to go through to get the radiation done. There was 35 treatments, Monday through Friday. Hell or high water, you were there. Okay, and if you missed one, you had to make it up. It's just that simple. But I didn't miss any of them. The last 2 weeks were the worst for me. I didn't want to go. My tongue was swollen. I had lesions that I didn't think I was ever going to get rid of. It was tough. But I got down there, and the people down there are, again, guardian angels taking care of people on the ground. Good thing. Anyway, here we go with the next one. Okay, radiation. So when you go into the radiation lab the first time, they actually make you a custom-made mask. Okay, it's very soft, it's pliable, it's flat when you go in there, and they put it on your face and they stretch it out until it fits your face. You can't move while you're doing it. It doesn't take very long, and it hardens up while you're wearing it. So it's you. So I was told that I couldn't cut my mustache off because it would change the dynamic of the way the mask fit me. So if you saw my pictures before, you know that I used to have a handlebar mustache almost down to my throat. So I lost all that from the radiation. And I lost a little bit of hair, but not much. Anyway, so this is the machine. This is me laying down on it. And what it did is it always took an x-ray first. They give you a little donut to hold on to so you don't move. And so it just slides you in, rotates around you, takes x-rays of what you look like after the last treatment, and then it starts the radiation. And it comes up and it rotates around and goes, and it shoots exactly where they want it to go. They mark the mask. It never moves because you're actually strapped down to the table with some bolts. Okay, and they make it comfortable for you. If you wanted a blanket, they give you a blanket, stuff like that. So anyway, this is me in my mask, and you can see they put a little bite plug in there, so I don't move. I noticed a couple of times that the plug was like I was getting shaky from holding it with my teeth and stuff like that. You just gotta relax. Anyway, I've got the mask right here, and this is what it looks like. It's really kind of scary looking. But, and you can see that they have dimensions on there. They got my name on there. And when you're all done, you get to take it home. So, it's big though. I mean, look at how long it is. But they have a little pillow under your head, and that's why it looks like that. And all those little X's is where they pinpointed where certain parts of my body had to sit and where they were going to come in at what kind of angle. Because I had it under my tongue, I had it in the back of my throat and all that, they had several different places that they had to shoot the radiation waves into me. Okay, so the radiation part did hurt. It doesn't hurt when it's being done, but the aftermath is pretty bad. So anyway, next thing, physical changes. You lose your ability to swallow. those are some of the complications that I went through. And like I said, I could only swallow a teaspoon of water at a time. And I'm gonna see if I can set this up on my phone. Oop, no, wrong way. Can't see my chickens out there. Okay, no, it won't work. Okay, so anyway, weight loss. I lost a lot of weight, and it was mainly because I didn't get enough calories that I needed to into my body soon enough, which made my stomach shrink, which made me not be able to put as much in my stomach as I needed to do, and I lost a lot of nutrition. I was instructed to consume 5 supplement boxes a day, but they only had 220 calories in them, and it wasn't enough. So again, the Ensure was probably the best one. You can look around, there's probably more. I'm not pushing them because I'm part of Ensure or anything. It just helped. Okay, my tongue shrank. I couldn't get my tongue past my bottom teeth. I couldn't rotate it over to the right or the left-hand side and touch my teeth anymore. My gums were shrinking. They were turning white. My teeth were spreading apart. So when I was trying to eat food, it was very difficult because I get lodged in there. And yeah, it was causing a lot of pain while I was eating. The saliva and the choking, big thing. That's why I told you about the Mucinex. Not everything helps, but I'll tell you, the only thing that really kept me going when I was gurgling in it, was taking those couple pieces of toilet paper, reaching as far back in my tongue as I can and wiping it out. Sometimes it'd take 2 or 3 times, but I could breathe again. And nobody told me about that. I mean, I call it a cow cut. You're going to see why when it happens to you. And then in the middle of the night, I'd wake up with dry mouth. So, and I think it's because I was mouth breathing because of everything going on. I used to wear a CPAP mask all the time, and then after I lost all the weight, I didn't need it. Gee. Anyway, and then I had sleeping problems. I was always going to the bathroom because of all the drinks I was doing. I still drink 7 to 10 bottles of water every day, and I am eating food, but I don't have the saliva like I should. So every time I eat something, I drink, at least 10 ounces of water to go with it just to get it down. So it's still difficult, and it doesn't have any flavor yet. And because of all this too, I'm getting, I'm losing my calories, which gives me, getting me dizzy and stuff like that too. So basically, the other thing is your emotional health. Okay, you're going to get irritable because you can't do things you used to be able to do. I got to the point where, hang on a second. I got to the point where I didn't want to do anything except stay in my room. I needed it was like having a migraine headache all over again. I felt lonely, even though I was surrounded by people. I had people motivating me to do things all the time. I just didn't want to do them. And like I said, I lost a lot of weight, and about 50 pounds. I'm slowly putting it back on, but it's not very fast. I'm eating small portions, even though I'm trying to eat more. It's taken me a long time, but I'm doing it. So that's the big thing. Get a little bit of hair loss, but like I said, I lost half of my mustache, but my face is really smooth. It's smooth as a baby's butt. But and anyway, I get sagging skin, and I actually saw somebody in the store one day not too long ago that I haven't seen since May, and I asked him how he was doing. He said fine. He introduced himself, and I said, "Hey, this is Willie," and he goes, "What?" Anyway, so things are getting better. I'm getting fatter again, plumping back up. I just want to make sure that everybody is healthy, and ask your doctor the right questions. And I hope this helped a little bit. I don't know. I'm kind of kind of don't do this kind of stuff. But what I do is I help people, and that's the type of engineer I am. I'm based in ergonomics and safety and all that kind of stuff. So please take care of yourself. Heed some of these things. I'm not trying to hurt anybody or scare anybody. I'm just telling you this is what happened to me, and because nobody else, until I found my friend Ronnie, nobody else told me about it. I had no clue, and he was just easygoing about it and said, "This is what you need to do," and I did, and I'm feeling better. So thank you, Ron. I appreciate it, and good luck to everybody. Hey, this is Willie one more time. What I'm going to do is I'm going to give you, this is the original paper that I wrote up. The other one that I was showing you is one that I'm going to give to the doctors, and I just want to let you know that take some screenshots of these things, okay? And let me know how it goes, okay? I guess you can put things at the bottom of the YouTube videos. I've never done that, but there's one. This is just basically going through what happened to me and how long it took, and when I saw the doctor for the first time. And after that, it got kicked into high gear. These guys are great. Everybody knew what was going on. I've got 7 or 8 different doctors. I've got all these lovely nurses that love me up and just take care of me, and it's great. Anyway, I'm going to go to the next 2 pages.